our second project, and it's quite close to the one we just heard. I think we have a different approach, so it's worth listening to it. And maybe we can join our groups together and work together on the same subject. Yes, I will tell you about all this stuff. I will not explain it too much because you will see it in Okay, the main idea of our product was to help elderly people to organize their daily tasks. So we thought we mainly do like a organizer for their tasks. For example, daily tasks like taking pills, such stuff. Recurring terms like weekly health checks or things they need to do regularly, and also single events like when they have an appointment with a doctor. Also, we would like to do some guidance. So, for example, if the patient has an appointment at the doctor, and like half an hour before the appointment starts, he's like at the other end of the town, the device will tell him to go to the appointment, and if he doesn't react, we have also an emergency system. I will explain all of that later, just the whole thing. Yes. Our target group, it's in general people who are unable to manage their daily routines, but still would like to be at home on their own. We would like to support them, especially for people who have problems remembering things like dementia in early stages and such stuff. Yes, as I said, our main focus was to do something like an organizer. So we mainly had appointments and such stuff, and we need to be inputted by someone. And we thought that the data input cannot really be done by the older people by themselves, because not many of them are able to use computers and such stuff. So we thought the data input will be done by either the care personnel responsible for them or by relatives. Yes. And for that we thought we would need something which either care personnel and relatives can use without having too much technical knowledge. I mean, like every person who is like around 50 or lower knows how to handle a computer, but lots of them are not really able to manage complicated programs. So we thought we would try to make the data input quite easy. So we were thinking about doing a web GUI, which should be quite easy to handle, and there you can add and edit all the appointments. That's the way we thought we would do the data storage. Mainly we have, I don't know how far I can walk. We have here the care personnel and as well the patient's family. They can input like daily routines, as I said, taking pills or I don't know, visiting a healthcare center, such stuff. And as well, if the patient visits a doctor, he can do an appointment proposal, and it can be confirmed by the care personnel or the patient's relatives, and then will be stored in this database. This database is in the cloud up here, and our device will regularly, like once an hour, check whether there are new appointments, and it's shown here, the database of our device will check whether there are new appointments or whether some have been deleted, and then update them. Yes. And then we have our emergency system. As I said, it's something like an organizer. So we mainly think that we should remind the persons who are bad in remembering things about all their appointments and such things. And if they are not reacting, we thought we should do some kind of emergency system, which in the beginning it will just ask the remind the patient about his appointment, and if he's not reacting, this device will contact some care personnel or relatives, as said before, and ask them what to do, and tell them, like, we have the exact coordinates of the patient, so we will tell him where the patient is and what happened, like he is in the east of Munich and hasn't reacted to what we told him about his appointment in the east of Munich at the doctor. And if the care personnel or relatives do not respond, we can as well call the ambulance, or depending on where the patient is, if he's somewhere out in the wild, we can as well call the police or something like that. The device we thought about should be something looking like a watch, and it should just have a huge button on top of it and an audio output. So we thought that most old people will not be able to use things like a smartphone, and as well, if they have something like that on their arm, which cannot be removed that easy, they don't forget to take it with them when they leave and such things. So the main idea is whenever an event occurs, like we remind him of our appointment, it all is done by audio output. We tell him, leave in 30 minutes, you have an appointment at the doctor, and the patient always has to confirm the last message by pressing the button. If he doesn't press the button, it's bad. This is what happened, as I explained before. Yes, our device also should contain GPS, so we can track where he's going, and especially if it has appointments, to tell him that he should really move in another direction to go to the doctor and such things. We need mobile radio connections all the time, so we can update our data frequently, and that we can as well send messages and such stuff. We need an exchangeable accu. Our idea was that, like, once a week, care personnel should go there and exchange the accu for the patient, so he doesn't do it by himself and forgets about it, such things. So it should be, we thought, if we do not have a screen and such things, maybe we could build a device which has enough accu capacity to last for a week. And as well, we would like to have a security lock, so that just not because he's used to it, the patient at night takes it off and forgets to put it on in the morning. So when he tries putting it off, we will tell him, are you sure you want to put it off? And then he can open it. Yes. Some problems we thought we would face when we will do this is the main thing is guidance. We would like to realize where the patient is going, and to realize when he's really heading to the doctor, or whether he has completely forgotten about it and is moving in another direction. I think it's quite complicated because you do not realize whether he's moving in the wrong direction because he wants to take a longer way, because he enjoys the environment over there more, or whether he completely forgot about it. So that would be a problem, the whole guidance thing. And also the connection, because it's not guaranteed to be there always, so we need to think about things what to do when the connection is lost, like whether we should do a call, and when we should do a call, I mean by external source, if the device, for example, is not responding like each hour. Yeah, we need to think about it. And as well, a problem, as I said, where we would like to have the lock is when the patient tries to remove it. And I mean, if the person is forgetting quite often things, he may forget to put it on back on. So that could be a problem. And also the appointments need to be updated by external personnel all the time. I mean, most older people would have someone to take care of them, like either care personnel or relatives. But yeah, there need to be a person. And yeah, also a problem is, especially when you have this lock, which, I mean, you can remove it, but it tells you not to remove it. And as well, when you tell the patient when he's leaving the wrong direction, you tell him to go there. It's a bit like you're controlling him, and maybe it's a mental issue if you trying to force the people to do it. some future features we thought about. I mean, we heard a lot of in the previous presentation what you could add on things, as well as the what's it called? The drug machine we saw in the morning. You can also integrate something like that, and as well we could use all this, smart home functions as said before. Yes. What we thought we would do here in Helsinki was, as well as the other group, we haven't done anything right now in implementation, just thought about the idea. So we thought what we could be able to do in the time here, and we thought about building an Android application, because like most people have Android phones, and you can program in Java. Most people are used to Java, at least in this room, I guess. We would not have any extra costs for hardware, and it contains all the sensors we would need. Yes, and if enough time left, we could also do the part with the GUI to input data, the web interface. Yes, the Android application should contain mainly the reminder, which is like the main core function, with the alarm function and the one button confirm function. Yes, as well we would like to start the position tracking and reaction when deviations occur, which will be hard to detect, but maybe we could think about it. And as well the first version of our emergency system. But as said, I mean, it's quite close to the project we heard just before, so maybe we could as well join our groups and work together. Yes, that was about it. Any questions?